our insurance expert, is back, and I have to even say, Craig, just the look on your face and the tone of our conversations has changed significantly. You came in 6 months ago saying, pretty positive, saying, hey, let's wait and see. You know, it looks like this, you know, some of these things could work out. What say you today, now that we're 11 days away from the deadline for people to sign up in order to have coverage on January 1st?
It's a nightmare. It's just.
I mean, really? I mean,
it's that bad.
You were the most positive. You're the one that kept saying, just hang on, let me gather the information. And you talk to insurance agents all over the country.
Yeah, it's really bad right now because we're even getting bad information of which hospitals and which doctors are in the network, what prescriptions you can use, people trying to figure out how their application's approved. It's just the whole thing. Covered California has a backlog, they say, of 7,000, 8,000. I think up to 25,000. I think the numbers are probably closer to 50,000.
And no matter what number the federal government uses in the big picture here, we always find out there's a big caveat, a big qualifier. They'll throw out a big number of people that have signed up, and we say, well, how many have actually paid? Well, almost none.
Yeah, and that's the other issue because of the process. So it came out with it last night or this morning that 300,000 people have signed up federally.
But that 300,000 people, they're looking for 7 million to sign up to make this thing work.
And I wonder, you know, and I think, and if you look at the wording of it, it was 300 was approved. I don't think they paid for it.
Correct. It was 300, and that's, again, that's the caveat I'm talking about. They say 300 approved. You say, well, how many actually will have coverage on the 1st? No idea, because very few of these people have actually paid for this yet. So let me get to some of our viewer questions and see if we can help people through this a little bit, because we don't want to just leave them panicked here. Kay from San Diego says, I went online to Covered California, completed my application. How do I know if it was received and I am approved? And when do I pay for it?
When you submit your application, it goes through the whole process, and it doesn't let you finish the application until everything's completed on it. If they're missing anything, they're going to get back with you. You're either going to get an email or you're going to get something in the mail to pay for your health insurance from Covered California. Because on the application it says how you'd like to be contacted, by email, by mail. So that's how you're going to end up paying for it. We've been expecting that people would get their bill by Christmas. Not the Christmas present they wanted, but at least we're going to have it. We don't know. I'm guessing right now people will be covered January 1st, but they haven't even paid for it yet. And I don't know how it's all going to work, because again, it goes, you apply to Covered California, they complete your application, they send it to the insurance company, the insurance company takes it on their end, goes through, makes sure everything else is completed, and then they get it approved and they send you a bill. We've seen how far it's gone so far and how bad it's been. Who knows how long it's going to take to get people policies in effect, ID cards.
Are you getting accurate numbers from the government?
No, I don't think anybody is.
Okay. Barry from Bonita says, I am hearing the list of brand name prescriptions that will be available in the Covered California plans will be smaller than what is available today. Is that correct? And how can I find out if my brand name prescriptions are in my Covered California plan? So the people are signing up for these plans, and they can't even tell if what they've had in the past is still available to them. Yeah, so you can't keep your plan. We know that now. That was not true.
No. And this is pretty new to us, because all of a sudden, like last week or so, we're starting to hear about, you know, the list of formulary or drugs, the brand name drugs, are a lot less. So what we're recommending people to do is to go to like the Blue Shield or the Blue Cross website, look up the drug and make sure it's in the plan, it's in the Covered California for 2000. The other issue going with that right now is that you got to make sure that your doctors, hospitals, and prescriptions are all in your plan now, where we never had to do this before. And that's part of the nightmare that we're seeing right now. It's so much more difficult.
You were telling me of a patient that actually called the hospital that they thought they were signed up for. The hospital said, oh yeah, we take your coverage. And then you find out, no, they don't.
Yeah, they don't.
So even the hospital doesn't know which coverage they accept.
The hospitals, the doctors are going, well, yeah, we take Blue Cross and Blue Shield and other companies today. But what we're finding out is, no, you don't January 1. And it's been really, really difficult, because as an agent, we just keep trying to get all the answers, and that's one of the things that we keep doing.
Okay, here's then the question, I guess, that everybody wants to know here. I've been watching Channel 6 for months, wondering what the benefits of using an agent are, and does it cost me money to use the agent versus going to Covered California and signing up for health care insurance myself? With all these questions, all this confusion, I'm not seeing the consumer navigating this without the help of an agent.
Right, and it costs nothing. If you're spending $300 a month for Covered California's plan, it costs you that money if you use an agent like myself or if you do it yourself. So the benefit of an agent is we're going to make sure that you're in the plan that has your doctor, that your prescriptions are in it, that the hospital you want to use are in it. Because again, right now, if you want UCSD or if you want Sharp, you got to use Blue Cross, because that's really the company that was working with them. You want Scripps, Palomar, Pomerado, you better use Blue Shield. Inside Covered California, right. And those are concerns we have, is we don't want you signing up for a plan and then finding out January, February that it isn't. Now the good part would be, if you did find out in January, February, you could reapply before March 31st and change your plan.
Okay. Craig Gusson, our insurance expert, again, stay with us here, hang in there, and keep bringing us the information, and keep helping folks wade through this thing. And
that's what we're here. We're here to educate and just help people understand and make sure that they get the right plan for themselves.
Okay. They survived.